I'm Dr. Nancy A. Dawson. I am the William M. Scholl Professor of Medicine and Oncology. I'm an attending physician at Montgomery General Hospital, where I specialize in urologic oncology. I attended Georgetown University Medical School, graduating in 1979, and then I did my internship residency in internal medicine at Walter Reed Army Medical Center. And then I did a fellowship in hematology and oncology also at Walter Reed Army Medical Center. I spent 20 years at Walter Reed Army Medical Center, and I retired as a colonel in the U.S. Army, of which I'm quite proud. And I have specialized in my area for many, many years, and I've been involved in the development of most of the drugs that are now approved in kidney cancer and prostate cancer. So every therapy that is in use, be it immunotherapy, chemotherapy, or targeted therapy, has been developed while I have been specializing in this area. So I have a unique perspective of exactly how these diseases are best treated, and also where we might be going in the future to better treat these types of cancers. It's very hard in today's world of oncology to know everything about a particular type of cancer. And from that standpoint, I think there's a special value added by having a patient see a physician who specifically specializes in a particular disease. And has been doing that for many, many years. There is an opportunity to talk to someone who knows this particular type of cancer better than anyone else, and that has a lot of value. Probably the biggest thing I bring is my experience. I am a urologic oncologist, so I'm highly specialized in treating my particular diseases. We're also going to be starting a multidisciplinary clinic, so we're going to be coordinating a urologist, and a medical oncologist, and a radiation oncologist for patients who need to have the opinion of all three of us, or two or three of us. Also, some of the therapies that are going to be available at Montgomery General Hospital that have not been there before. There is a new therapy for prostate cancer known as Provenge. It's an immune therapy, and that's going to be available at Montgomery General Hospital and previously has not been. We also hope to, in the very near future, start clinical trials at Montgomery General Hospital for patients who have urologic oncology problems. Clinical trials are always changing, so you can't really actually tell someone right now what clinical trials might be available in a year. But we, as a group of doctors actually in the Washington-Baltimore area, are actually trying to make referring physicians more aware of what clinical trials are available in the Washington-Baltimore area in the area of urologic oncology. And these will change. So we will be putting together a website in the very near future where you can actually find out if there is an appropriate clinical trial for your patient, either at Montgomery General Hospital or at one of the other large hospitals in the area where clinical trials are going on in the areas of prostate cancer, kidney, bladder, or testicular cancer. Probably the easiest way to find out about a clinical trial, if there's one appropriate for your patient and how to get your patient seen as quickly as possible, is to give me a direct phone call. I'm always happy to discuss your patients with you by phone, and if we have a study that they would be a candidate for, I could tell you about the study. Studies change, so what's available this month or next month can be quite different, so feel free to just give me a call. I usually communicate to my referring physicians is through our notes. One of the best things I can say about electronic medical records is it allows us, once we see a patient, to be able to immediately get a note to the referring physician. If a particular physician would prefer that I call them by phone, I'm happy to do that. But I find that getting a complete note with sort of the thought process that I went through in making a recommendation is probably the most thorough way of getting information to my referring doctors.